That's true. That's why I'm here.
Yeah, I mean, you always give us the latest, and I reached out to you because I was saying like now that the president has started his recovery from
Hmm.
contracting COVID-19
Right.
again. I don't think this might be his third time that he's gotten it, and I know people in our own offices have gotten it, and some experience some symptoms, some people none at all, some people being down for 5, 6, 7, 8 days. Why
Hmm.
different variations for people contracting, COVID-19 the second or third time? It's different for everybody, right?
It's different for everybody. And President Biden has had it twice. And, you may think he's had it three times because after the first time he had a rebound after he had taken this Paxlovid, and we can talk about that if we have time.
Yeah.
And so you're right. Everybody experiences it differently. We've seen the greatest impact in those over the age of 60. And this is with and without vaccination. Certainly without vaccinations, they are driving the hospitalizations. And with vaccinations, they've still contracted it and have been sick, and generally sometimes have more symptoms than people who are younger because they have more chronic medical conditions. As you get older, you get more stuff.
Right.
So not their fault. And that's why sometimes you can see some variability and variations. It depends oftentimes on the patient's underlying health status.
Could somebody contract COVID and not know it and go automatically just through the whole entire process and then go back to normal and not even know they had gotten it again?
100% typhoid, typhoid Mary. Yes. You can have COVID, not know you have it, not have symptoms. It's rare, but you can certainly have COVID and not have symptoms, and maybe discover later if you're doing some type of blood test that you have antibodies or something to that degree. But don't forget, even if for whatever reason you're asymptomatic, or maybe you have mild symptoms and you're attributing them to allergies or asthma or whatever else, you are still contagious, regardless of whether you feel good or not.
Right.
And even though you may not have symptoms, it doesn't mean that you will give it to someone else. It could be devastating to someone else. So just because you may not have symptoms or you have mild symptoms, remember, you are still contagious.
We're going to have more with Dr. Jane Morgan. We're going to got to talk RSV, and we
Okay.
also got to talk, if it's COVID, Paxlovid, because
Right.
that's going to be a commercial that I'm seeing everywhere. When we come back, it's Ryan Cameron Uncensored. And we're back with Dr. Jane Morgan. We're talking about RSV now. We've talked about COVID-19. What's the difference between somebody who, is RSV something that could eventually turn into something else, bronchitis, pneumonia? Because I've seen more and more people that start off with just a regular cough, and then they say, oh, I've had this cough for 2 or 3 weeks, or I've had this cough for a month. And I'm like, you might need to go see somebody.
That's right. That's right. And so what you're describing is a post-viral cough. And sometimes we do see people with that. And so they actually are not contagious any longer. They're beyond the 5 or 10 day window, but they're having reactive airways, meaning their lungs and their bronchi are still sort of a little hypersensitive, and they continue to cough. This can sometimes be treated a little bit with steroids or sometimes with asthma medications. But we can see that, unfortunately. It can go out to 4 to 6 weeks. And again, the older you are, the more chronic medical conditions, the more likely you may be to get this prolonged cough. With RSV, you asked about RSV.
Yeah.
RSV follows sort of the seasonal variations of most viruses. So, COVID has kind of hung as an outlier of the viruses, not hanging with the pack. And we keep seeing summer surges and spring surges, but most of its sisters and brothers and cousins in the viral family surge in the fall and winter. That's when we see viruses, and that's when we have the biggest risk of RSV, respiratory syncytial virus, which is really more common in children and can certainly threaten their health in children, drives hospitalizations in pediatric centers, but we see it increasingly as well in people as they get older.
Are we going to start to see, as get ready for back to school,
Right,
in colleges and grade school, all these kids coming back together, people sending their kids to school, to colleges sick? Are we going to see another surge in a couple of months once, August gets here?
We always do so far. School comes back, we see a surge. Thanksgiving, we see a surge. Christmas, we see a surge. So I think we can expect that. And, parents, please be responsible. And certainly we know you have to go to work. It's inconvenient for the kids to be home. But, if your kids are sick and you send them to school and they get other kids sick, it really is a domino effect that actually can then come back on you. If you have multiple children in school, another one is sick, and now you're sick. It would have just probably been better to try to keep your child at home as we are battling these new variants. Even though our health emergency is over, don't forget the World Health Organization, the WHO, the World Health Organization still has us in a pandemic as long as these variants are emerging. They are continuing to keep an eye on it. As long as we are continuing to need vaccinations, and they are being recommended, the next one should be out next month. With these current variants, the World Health Organization still has us in a current pandemic, and our variants currently KP2, KP3, LB1. So these are the variants that are out now circulating.
All right, we got more. We're going to come back in for everybody who has a child that's going back to college or high school or elementary school. We'll talk about some of these things if you do come down with the virus. And I want to ask you about something that somebody recommended to me on a plane. I don't know if she'll confirm or deny this, but when we come back.
All right, let's talk about plane talk.
It is Ryan Cameron Uncensored, and we have Dr. Jane Morgan on, and we're talking about everything virus. We talked about RSV. Now let's talk about Paxlovid. I've seen the slogan, and if it's COVID, it's Paxlovid. What's different between that and is it for somebody who has been vaccinated, boosted, and everything else, or for somebody who has none and then all of a sudden comes down with it? Who is it the ideal candidate?
Yeah, so the ideal candidate is the person who is at risk of progressing to more severe disease. So that's going to depend on your individual history, including previous COVID infections and how you have managed them and what types of symptoms that you have had. But the point of Paxlovid is to decrease the viral load in your body. The fewer viral particles you have, the less sick you will be. So Paxlovid attacks those viruses, brings those viral particles down within 4 to 5 days, such that you don't have as severe an illness. Rebound really means that after 5 days of taking Paxlovid, it still didn't drive your viral load down low enough such that it could go away. And then once you stopped taking it, the virus just started to replicate again. That's what happens with Paxlovid. Why some people can get their viral loads all the way down and they have no symptoms, and others get down low. It almost seems as if some people maybe need one more day of Paxlovid, day 6 or day 7, but the prescription is day 5. It manages most people, but we do see some outliers with this rebound because the viral load didn't get down low enough.
I'm seeing more people that are coming off of plane trips and saying they caught something on the plane, or there was somebody on the plane who was, coughing incessantly, or they wouldn't stop coughing. They're like, man, I know I got on the plane. I'm telling you, I got on the plane. This is something that I saw. I don't know if you can see that or not. It says it helps block airborne viruses for 6 hours. It's a nasal spray. Have you heard of this?
And so I may have heard something about this Covixel, and I don't know what the active ingredient is in it, and so I don't know if it really can block. That's unclear to me. It certainly hasn't gone through FDA approval. So I haven't seen that with the research data that would go through FDA approval. However, if you want to try it, try it. Here's what I will say. I'm on planes a lot as well. And you're right. There's always someone coughing. It's rude. It's rude and unfortunate, even without COVID. If you are coughing to that degree and you're sick, why are you traveling? That is inconsiderate. It's selfish. You're in a tight environment. That cough didn't start when the plane took off. And then most of these people are not masked. You're correct. I've been on planes as well, and people are coughing. You have no idea what it is. So far, knock on wood, I haven't gotten sick, but that doesn't mean that they haven't infected people around them.
And that's why whenever I'm on a plane, I always look to the left and I go, "Stop coughing, baby."
Right.
I'm just kidding.
Keep your mask with you. You
Yeah.
know, masks are quite effective, especially N95 masks. And you can just have it with you and decide when you need to put it on or not. If somebody's coughing next to you, pull out your mask, turn your head in the opposite direction, keep yourself as healthy as possible. The virus enters through the nasal cavities. And so, you know, if you can block your nose and block actually the access to your nose, then that's actually quite helpful. It's the same reason that, you know, when you're out in cold weather, you know, people see your grandmother, mother say, bundle up because you will get cold, or, you know, put your scarf on. It's the same thing, because as cold weather and temperature hits your nose, that as that temperature decreases, it actually decreases your ability to filter particles. And so more and more particles get in, the lower the temperature. And so you will become more sick because you're more exposed, your immune defenses go down.
There you go. I want to thank Dr. Jane Morgan, cardiologist and executive director of health literacy and community education at the Piedmont Healthcare Corporation in Atlanta, as always, for great information. And always, Dr. Morgan, for whenever I make the call, you always answer. We really appreciate
I am here. You guys can follow me on social media at Dr. Jane Morgan, Jayne, and I'm there. I give medical advice every single day. Ryan, love coming on with you.
Thanks, Dr. Morgan.
Bye.
Bye-bye.